But Dr. Emanuel, let's start with this news from J&J. Does this concern you?
Well, anytime there's a serious adverse event, it has to concern you. But I think as J&J CFO explained, you have to let the process evolve. You have to actually examine carefully what the situation is, what the adverse event is. Was it related to the vaccine or placebo, or was it related to something else, a pre-existing condition? And so those are exactly the kind of questions that researchers will look at and try to uncover in the next few hours. And then we'll find out more. If it's in the arm of the vaccine, it does raise serious questions because you only have a few thousand people in a study like this. One adverse event is serious, especially when you're considering a vaccine that you're going to roll out to tens, hundreds of millions of people, maybe even billions of people. That's the ultimate concern. And this is actually standard process for every research study. You get a serious adverse event, you investigate it.
Yeah, it happens all the time. It's just that the world's not always watching so closely to see what the developments
Correct.
are.
Exactly.
Probably worth pointing out that the CFO of Johnson & Johnson also pointed out they don't know any of these answers because they have turned it all over to independent investigators. And that is what kind of beefs up the credibility issues around this. The CFO himself has no idea, even though this was 36 hours ago, whether this was in a placebo patient or someone who actually received the vaccine. We'll continue to watch.
I would also say that they've been carefully collaborating with the NIH on this trial. And, that I also think should give the American public some reassurance that this is going to be done thoroughly and to the highest scientific standards.
Shepard Smith here. Thanks for watching CNBC on YouTube.